A drug patent judgment in India, an environmental pollution suit in Spain, a failure to treat a woman dying during childbirth in Brazil. Until now, there has not been a database that solely focuses on cases and legal instruments involving health and human rights. Our new database is the first and only one of its kind. Simply, it is an online, free, up-to-date, and user-friendly repository of cases and legal instruments that demonstrate the intersection of health and human rights.
We were astounded that no such comprehensive database has ever existed. And so we set about the task of working hard with wonderful partners from around the world to try to make it happen, and it has, and I'm so delighted.
It was first conceived as a partnership between the World Health Organization and the ONeill Institute. This is an idea the World Health Organization had in their work plan for quite a long time. We decided to partner with them, and along the way we found out the Lawyers Collective was working on a similar database, so then we decided to partner with the Lawyers Collective. I think the Lawyers Collective brings that more on-the-ground expertise, being an NGO from India that has litigated cases, and they have now a network of organizations all over the world. At some point, we hope we can welcome back WHO as a partner and other UN organizations that are interested in partnering with us in the database.
What the database does, it just links people together. So if a lawyer needs to know what courts have said about it, they'll know. If they want to know what their constitution says, they'll know. If members of the community want to understand, well, what are human rights? How can I use them? They'll be able to see it. And so this brings all the world's resources about health and human rights, two of the most important things in the whole world, health and human rights, together in a comprehensive, understandable way.
Established in 2007, the ONeill Institute represents the need for innovative solutions to the most pressing health concerns. It reflects the importance of public and private law in health policy analysis. Housed at Georgetown University Law Center in Washington, D.C., the Institute is made up of a multidisciplinary team of faculty, fellows, staff, affiliates, and alumni with a range of experience and expertise in the fields of law and health.
It's one of our signature projects. We think the law is an essential tool to help advance health, to help us achieve better health conditions at the population level, at the individual level. And I think this database is a way to reflect what has already been happening and hopefully identify ways in which we can grow and we can advance the use of law for health.
The Institute is comprised of 7 thematic areas, which include health and human rights. Our integrated approach combines elements of research projects, capacity building, and scholarship that draw upon the ONeill Institute's intellectual strengths and those available through the broader university. The Institute hopes to encourage decision-makers in the public, private, and civil society sectors to employ the law as a positive tool to enable individuals throughout the world to lead healthier lives.
We're starting right now. We're just collecting our data and having all of our cases categorized and put together in one place. So how many cases do we have in the database? I think we're hoping to have around 1,000 by the time. At some point, I think we'll move, and we should move to a second stage in the project in which we start doing some analysis and start identifying trends and start seeing what's going on in the world around health and human rights and how we can use that knowledge to help improve the condition of people on the ground.
Anna, a quick question. Do you have enough Spanish-speaking RAs to handle this upcoming caseload?
Yes, actually, we do have someone who is coming in from Mexico.
The vision for the ONeill Institute is grounded on the idea that law has been and will remain a fundamental tool for solving critical health problems in our global, national, and local communities. The Global Health and Human Rights Database embodies this vision.
I'm very proud of the ONeill Institute because it requires world-class scholarship to actually make a difference in the world, to actually touch people's lives. We want to improve people's lives, we want to save people's lives, we want to use human rights to do it, and we want to use the world-class thinking and intellectual rigor with our partners in civil society that means so much to us.